Well, our top story on the show today, our big focus, there's growing international alarm over the new variant of coronavirus in the UK, with a host of countries imposing travel bans. More than 40 countries have barred UK arrivals as the EU held talks on forming a common policy. Now, the World Health Organization, meanwhile, has said that the new coronavirus variant is not yet out of control and can be contained using existing measures. British Health Secretary Matt Hancock had earlier claimed that the new variant was out of control, with British officials saying that it was 70% more transmissible than the main strain. While the new strain is more transmissible, there is no evidence it is more deadly. Some experts also believe that the new strain has already spread beyond where it's been reported, crediting the UK's use of genomic surveillance for detecting. Well, to talk more about the UK variant that's created such alarm across the world, we're joined now by Dr. Ravindra Gupta, Professor of Clinical Microbiology, Department of Medicine, University of Cambridge. Thank you so much, Doctor, for joining us again. And the last time we spoke, you had talked about mutations in the virus, and it's something that you are studying. What can you tell us about this variant? Experts are also, divided over whether it is more transmissible or not.
So this new variant has emerged in the UK in the last couple of few weeks, and it has a number of mutations. Some of them are of concern because they're in some of the important parts of the spike protein, and we want to stop transmission of this variant. Although it does not cause any more severe disease, it does appear to travel faster through the population. Now, this needs to be confirmed, but that is the concern, that this is a more transmissible, more mutated form of SARS coronavirus 2, which we want to hold off.
Right. Some experts are even saying that this variant may have been around for even longer. It was detected in September, but it could have been around even longer. Just because of the lockdown, it hadn't managed to spread so much. And after the restrictions lifted and people started mingling, and given it's leading up to Christmas, possibly that is when it spread so widely.
Yes, that's usually how new strains emerge. They always start slowly. Any new virus will take time to increase in frequency in the population, so that is normal.
And given the changes, they're talking about how it has 23 mutations, how 17 of those mutations emerge together. Just put this into context first. What does this mean?
Well, it means that somehow these mutations have come on the same virus, and that is quite unusual. And so what we think is that this probably happened within one person or two people who had the virus for a long period of time. We know that some people carry the virus for a long period of time. Sometimes they have immune suppression, and sometimes for other reasons. So it's most likely that this was from a person who had it for a very long time.
All right, and that is how the virus mutates, not if it's in a host for a very long time, and once it perhaps from there it spreads, and even super spreader events are being spoken about.
Yes, it's potentially due to that, and potentially due to other therapies that could be received, such as plasma or antibody therapy. So we described in a report on preprint recently a virus that was isolated, which had only 2 mutations, but this was directly after a patient was given convalescent plasma in the context of immune suppression. So this is one of the conditions which could produce mutations in the virus, and we should be rather cautious when using plasma.
If you could explain that further to us, you're saying that even plasma therapy can lead to some of these mutations, not necessarily this one, but it is causing mutations.
If you use plasma or antibody therapy in somebody with very, very poor immune function, then the problem is that the virus is only fighting against one set of antibodies which you're injecting into the patient. And those antibodies do not necessarily reach all of the viruses or all of the places where the virus is dividing or making copies. So we do need to be careful of using therapies like this in people with very poor immune function. And potentially we need to keep them in some kind of isolation with regular testing and sequencing of the virus to make sure that mutations are not emerging.
Right, and of course the big concern is about the vaccination. Now in the UK, the vaccination program has begun, and already Pfizer and Moderna are testing their vaccines against this new strain.
So the vaccine, I'm pretty confident, will still be highly effective against this strain, because when you give a vaccine, it is different from giving a therapy of antibodies. A vaccine produces many different types of immune responses, including cellular as well as antibody protein responses. And these responses are targeting all very different parts of the virus spike protein. So I'm confident at the moment that the vaccine will work, but we do not want this virus to keep mutating. That's the problem.
Right, so that's very positive news. You're quite confident that the vaccine will be effective against this strain of the virus. Though, when will we know for sure? After some time, as people are still being vaccinated with the first dose of the vaccination?
Yes, to understand properly about vaccine efficacy, it will take some weeks or months. But in the meantime, we need to make sure that the spread of coronavirus is limited as much as possible.
And therefore, given the lockdown that, the UK is currently under, millions of people are under lockdown. Last time we spoke, you'd also expressed concern about, how the vaccination program, while it has begun, it can't be too slow. You had said it has to be, the core population needs to be vaccinated quickly, so that you said the virus would mutate once if the vaccination program is too slow. If you could explain that.
Well, what I said is that we need to shut down transmission of the virus and the new strain as quickly as possible, and stepping up the vaccine is a key part of that. Of course, there are limited supplies, and so the government is vaccinating as fast as possible, but we need to be using vaccines in the longer term, because we can't be locked down for long periods of time, as you know.
Right, and finally, Doctor, also a new strain has emerged in South Africa, and this variant is different from the UK variant. That's what the WHO has said. What do you know about that? In fact, there's some report that perhaps it's more potent, that it's affecting the younger people more, it's causing more hospitalizations.
Well, the new variant in South Africa is a different one from the UK. It does share one mutation in particular in the spike protein, but this is a mutation which has arisen, which was present before and has seeded in many countries. So, but in the South Africa, they have, again, many more mutations on the same virus. I'm not clear about how transmissible this one is, but it is a very high proportion of all the new infections, which suggests that it has some kind of advantage. And we need to, again, understand more about that. And I'm working closely with colleagues in South Africa to understand the biology of this new virus.
So the South African variant of the virus, if we could call it that, is more concerning right now than the UK one, given that they're claiming it's causing more hospitalizations and even more deaths?
I think that's hard to really fully understand, because if this new variant is responsible for 80 to 90% of the new infections, then it's hard to make a comparison with the other 10%. So I think that it's early days to say whether this is a more dangerous variant in South Africa. I wouldn't make those conclusions so quickly.
All right. Well, thank you so much, Doctor, for joining us once again on the show and speaking to us about these concerns and questions regarding reports of the new variants, both in UK and South Africa.
Thank you.
Well, let's now bring you India numbers. Remember, India is also one of the countries that has now stopped flights coming in from UK. That will take place at midnight tonight, because we don't want this new virus coming into the country that is more infectious. Today, India added 19,556 new coronavirus infections in the past 24 hours, and that's the lowest since the 2nd of July, according to the Health Ministry data that was released today. The country's total number of COVID cases is now 1,75,116. The number of COVID-related deaths reported from across the country in this period was 301. That takes the total number of deaths to 1,46,111. The recovery rate currently is 95.6%. The death rate is 1.5%, and the positivity rate is at 2.4% currently. So let's take a look at the top 5 states that are reporting the highest number of cases. And as you can see there, it is Kerala that's reported the highest number of cases in the last 24 hours with 3,423 cases, followed by Maharashtra with 2,834 cases, then West Bengal with 1,515, Chhattisgarh with 1,258, and Tamil Nadu with just over 1,000 cases. And if we look at the number of deaths reported in this 24-hour period, then Maharashtra topping that list with 55, followed by West Bengal with 41. Kerala and Delhi both reporting 27 deaths, Chhattisgarh 18, and Uttar Pradesh with 16 deaths. Well, it's time now for our viewers' question segment, and we're joined by Dr. Sharwari Dhabade, a consultant internal medicine, Fortis. Thank you so much, doctor, for joining us, and let's listen in to the first question. Thank you so much for having
me on the show.
All right, let's listen into the first question.
The first query that's coming up is, now that a new strain of coronavirus has been found in UK, is there a possibility that the strain has already come to India?
All right, he was asking, of course, everybody's concerned about this new strain of coronavirus that's being reported in the UK, and we do know that we're going to be stopping flights from the UK tonight, but he's asking whether it could have already entered India.
Yes, so since a couple of days, ever since this news came out, and everybody was cautious about it because it is supposed to be a more virulent strain, everybody was concerned that this could have already entered, or have we already been exposed to this kind of strain. Well, it is really difficult to say at this point in time because we are seeing that the infectivity rate in India somehow has been declining over the last week or two. And to say that there's a new strain that has come in, well, only the data in the coming days will tell us for sure. The measures that we take, like stopping the flights from the UK, I'm sure will help us in curbing the entry of the new strain into our country. Well, if it is already there in the country, none of us are sure definitely about it. But if it is already there, I think the only way we can stay away or keep ourselves safe is by continuing our hygiene measures and wearing a mask all the time.
Right, continuing with this COVID culture that we've all gotten used to over the last couple of months, yes, of masks and social distancing. Let's listen into this next question.
Sure.
I have to travel back home from another city. What is safer? Road travel by hired car, train, or by air?
Right, a question facing many people right now. It's the holiday season, and they're wondering what is the safest way of long travel.
Yes, well, I know that everybody is very keen on stepping out of the house, as we are all been confined for a really long time now. But I think first and foremost, safety is the most important. Wherever there is a free air circulation, it is considered to be a better option. A personal car would mean, that is what I suppose, that a personal car would mean personal hygiene, and you would know the authenticity of that vehicle. Whereas for a public transport, you would always have to be aware of people sitting next to you, about the seats or about the common places where you're going to touch. So hand hygiene and mask is going to be important if we choose any public transport, be it air or trains or buses. Whereas in your own car, your self-driven car would be safer in the sense that you would not have to worry about the other surroundings.
All right. Well, thank you so much, Doctor, for joining us and sparing your time to answer those questions.
Thank you. Thank you so much.